Hello everyone, myself Savitha, Assistant Professor, Department of Medical Surgical Nursing, Yenepoya Nursing College. In this session, we will be learning about nursing management of patient with tonsillitis. Learning objectives are define tonsillitis, list down the types of tonsillitis, enumerate the etiology and risk factors for tonsillitis, explain the pathophysiology of tonsillitis, list down the clinical features of tonsillitis, enlist the diagnostic evaluation of tonsillitis, and explain the management of tonsillitis. Tonsillitis is a term commonly used to describe the inflammation and infection of two palatine tonsils. The purpose of these lymphoid tissues is to filter and protect the respiratory and digestive tracts from invasion by pathogens. But often the tonsils become site for infection. So tonsils are the two round fleshy masses which is present at the back of the throat, and these are the part of immune system and it will be helping the body to protect from infection. Next we'll move on to the definition. Tonsillitis is inflammation of the tonsils, most commonly caused by viral or a bacterial infection. It may occur when the patient's resistance is low and the onset is always sudden and often goes away on its own after 4 to 10 days. Okay. Inflammation of the tonsils is called as a tonsillitis, and it may be seen in a people with the low immunity, and the onset of this infection is always rapid and it subsides within a 4 to 10 days. Next is about the types of tonsillitis. There are three types. First one is acute tonsillitis, chronic tonsillitis, recurrent tonsillitis. So acute tonsillitis, here infection will be present for the short duration. It lasts from 3 days up to 2 weeks. Then the chronic tonsillitis, here infection will be present for the longer duration. It may be longer than 2 weeks. And the third one is recurrent tonsillitis. So here infection happens several times in a year. It may be more than 7 episodes in a year. Next we'll move on to the etiology. The first one is a viral infection. So viral infection is a most common cause for tonsillitis. Mainly it is caused by Epstein-Barr virus, herpes simplex virus, influenza virus and the adenovirus. And the second one is bacterial infection. So this is a less common cause, but it happens in a severe form. And the bacteria which is causing this infection is a group A beta streptococci. Next is about the risk factors, or in other term we call it as predisposing factors. So it is categorized into two, endogenous factors and the exogenous factors. So under endogenous factors, it is also called as the internal factors. Something is wrong within the body system. Okay. So here first one is a person who is suffering with the upper respiratory tract infection. They are prone to develop with this tonsillitis. And the second one is a post-nasal discharge due to sinusitis. Sinusitis means it is an inflammation of the sinus. In this case, the patient may have a feel of mucus is dripping down to the back of the throat. That is called as a post-nasal discharge or a post-nasal drips. And the last one is residential tonsil tissue after tonsillectomy. So these are the factors which is coming under endogenous factors which is leading to tonsillitis. And the second one is exogenous factors. It is also called as the external factors which is leading to tonsillitis. Okay, if the person is having a more amount of excessive intake of cold drinks and the food, or the close contact with the infected person, and the people those who are living in a crowd and the poor ventilated environment, then if anything like a embedded foreign or a foreign body anything is stuck in a throat, and the extremely cold climate. So these are the factors which is coming under exogenous. Okay. Next we'll move on to the pathophysiology. Infectious agent inoculated that will lead to localized inflammation, that leads to enlargement and redness of the tonsils, and that will be resulting with clinical manifestations. Okay. So here the entry of bacteria or a virus into the body. So in that time the body's immune system will be getting activated, and because of this activation of the immune system there will be a inflammatory process will be begins. So in this inflammatory process the body start releasing a chemicals, that is the cytokines and the histamine. So these chemicals will allow the blood vessels to dilate, and it will increases the blood supply to the affected region. So there will be a presence of redness over the tonsils. Along with that there will be a activation of nerve ending. So the patient will be having a pain in that infected region, and also there will be a leakage of fluid into the tissues, which is leading to the occurrence of swelling or a enlargement. Okay. So because of all this inflammatory changes or inflammation process, which will be leading to enlargement and the redness of the tonsils, and once the infection progresses it may lead to further appearance of some of the clinical features. So we'll next move on to the clinical features as per the types of tonsillitis. That first one is under acute tonsillitis, the patient may have fever, sore throat, dysphagia, that is difficulty in swallowing, odynophagia, that is pain on swallowing, then tender lymph nodes in the neck, that is a painful lymph nodes will be present over the neck region, and there will be a presence of white patches and the bad breath. So in the second type, in that under recurrent tonsillitis, or it is also called as a subacute tonsillitis, in that the patient will be having sore throat, dysphagia, swollen neck glands, fever and the enlarged tonsils. And in the case of chronic form, that is called as a chronic tonsillitis, in that chronic sore throat will be there, throat remains uncomfortable, and there will be a persistent lymph nodes in the neck, and also the patient will be having a bad breath. Then the other clinical features involves fever, chills, ear pain, headache, hoarseness of voice and the sleep apnea. Sleep apnea means it is a serious sleep disorder. Here the patient's breath will stop and suddenly it will start during a sleep. So that is called as a sleep apnea. Next is about the complications of tonsillitis. That first one is chronic tonsillitis as a result of incomplete resolution of acute tonsillitis. And the second one is peritonsillar abscess. So when the infection spreads from the tonsils into the surrounding tissue, that will be resulting with peritonsillar abscess. In the sense, the pus formation around the surrounding tissues of the tonsil. Then parapharyngeal abscess. Parapharyngeal in the sense the area which is near to the pharynx, there also the pus formation will be there because of the spread of infection. Then acute otitis media means it is a middle ear infection. Because of the recurrent attack of tonsillitis, the patient may develop with the complication of otitis media. Then the next one is rheumatic fever. So this is an inflammatory disease which is affecting to the heart and often seen in association with tonsillitis due to group A beta hemolytic streptococci. And the last one is subacute bacterial endocarditis. So here there will be inflammation of the endocardium when the bacteria enters the bloodstream and it is getting attached with the heart valves, which will be leading to endocarditis. Okay. So these are the major complications which is happening because of the tonsillitis. Next is a diagnostic evaluation. In that, first and foremost you have to go with the history collection. History collection in order to know the causative factors or risk factors, and also to identify with the symptoms what is present in the patient. And the second one is physical examination in order to find out the signs and the physical appearance in the patient. Then you can go with the throat swab for culture in order to confirm with the pathogens, like whether it is because of the viral infection or because of the bacterial infection. Then the blood investigation or a blood test will be done to confirm the presence of infection and to rule out the organism. Next is about the management part. So here first thing is supportive care must be given to the patient. Advise the patient to take adequate rest and advise him to drink warm fluids, gargle with warm salt water in order to soothe the throat. Then treat coexisting infections. So along with the tonsillitis, if the patient is having a teeth infection or a ear infection means that must be treated. Then advise the patient to avoid irritants like such as cigarette smoking has to be avoided. Next is the pharmacological management. So in that first thing comes is the antibiotics. Since there is an infection which is caused by viral or a bacteria, so antibiotics has to be started. Then the analgesics in order to get rid of the pain, aspirin and the paracetamol lozenges will be used. Then the antimicrobial therapy, in that mainly used drugs are the penicillin and the erythromycin, which will be given for 7 to 10 days. And the penicillin will be drug of choice for the infection which is caused by streptococci. Then if the patient is allergic to penicillin, we can go with the drug like erythromycin and the amoxicillin. Then antiviral therapy can be given, that is if the virus is a causative agent for this tonsillitis means. So example is acyclovir, which will be given in the case of herpes simplex viral infection. Then the antipyretics will be given in order to treat the fever. Then the non-steroidal anti-inflammatory drugs will be given such as ibuprofen in order to decrease the swelling, pain and the fever in the patient. Then oxygen administration can be given in the case of breathing difficulty. So these are the major pharmacological management for tonsillitis. Next is the dietary management. And that first thing is nutritious diet and the vitamin supplement will be suggested in order to support the immune system of the patient. Then soft diet will be advised in order to allow for easy swallowing of the necessary nutrients. Then advise the patient to take plenty of fluids in order to prevent the dehydration and avoid spicy food items. It minimizes the throat irritation. So mainly they have to focus to boost up their immunity. Nutritious and the balanced diet has to be taken. Next one is a surgical management. In that the procedure called tonsillectomy will be used over here, that is a surgical removal of tonsils. Next is about the nursing management. In that first part comes as a assessment. So in that pre-admission assessment must be done and you have to go with the history collection, check the vital signs of the patient and check for dehydration. The major signs of dehydration is dryness of the mouth and the increased thirst in the patient. So under the history, mainly onset and the duration of symptoms has to be asked. Then recent infections or is there any history of contact with the infected individuals, and difficulty in swallowing, fever and the pain level has to be asked. Then under the physical examination, you need to inspect the throat for the presence of redness, swelling and the white patches and palpate the neck lymph nodes for swelling and assess the hydration status in order to check. Because of the dysphagia, patient won't be able to take adequate amount of fluids, so hydration status has to be assessed by assessing the urine output and also by assessing the skin turgor of the patient. You will come to know the hydration status of the patient. Then monitor for signs of airway obstruction like breathing difficulty or the presence of cyanosis, which indicates there is a presence of airway obstruction in the patient. So these are the major assessment which will be done under physical examination. Then next is about the nursing diagnosis. As per this, the patient who are suffering with the tonsillitis, you can write up these are the nursing diagnosis. The first one is acute pain related to inflammation of tonsils and the surgical procedure. And the second one is impaired breathing pattern related to upper respiratory tract infection, deficient fluid volume related to inadequate oral intake secondary to painful swallowing, imbalanced nutrition pattern related to difficulty in swallowing, Then deficient knowledge related to caregivers, understanding of discharge, home care and the signs and symptoms of complications. And the last one is risk for aspiration related to impaired swallowing and bleeding at the operative site. So these are the nursing diagnosis you can frame for the patient who are suffering with the tonsillitis as per the problems which is identified in the patient. Next is about the nursing interventions, and that first thing is a prevent aspiration. So here, to prevent the aspiration, you can suggest the patient to maintain proper oral hygiene and to maintain an upright position on meals. Then relieve pain by using analgesics, or you can advise the patient to do the warm salt water gargling, and encourage the patient to take more of fluids, and provide family teaching mainly regarding the hygiene need to be taught to the family members. Then maintaining the breathing pattern by assessing the respiratory rate of the patient and by giving a Fowler's position for the patient. Then the next thing is maintaining the nutritional status. So advise him to take well balanced diet, since he'll be having a dysphagia, advise to take a soft diet. Then monitor for complications such as chronic tonsillitis, otitis media, rheumatic fever, peritonsillar abscess and the parapharyngeal abscess. Next is about the preoperative care. So preoperative care, in that check the required investigations, check for the vital signs 4th hourly in order to find out for the changes in the physiological status of the patient. Then mild sedative may be given at night in order to relieve anxiety and to induce sleep. Then the written informed consent has to be taken before surgery. Next is about the post-operative care. Here you need to check the level of consciousness of the patient and provide semi-prone position to bring out the secretions. So here we are using a semi-prone position mainly to prevent aspiration in the patient soon after the surgery. Then close monitoring of the patient is important because of the significant risk of bleeding. Then check the vital signs, observe for signs of shock like rapid heart rate, rapid pulse, or the presence of hypotension in the patient. Then administration of prescribed medicines and the IV fluids to the patient. Then maintain intake and output chart of the patient. Then along with that, first liquid or a semi-liquid diet will be given to the patient during the post-operative period. Then advise the patient to avoid too much talking and coughing. Then maintain oral hygiene, administration of analgesics and the antibiotics as prescribed by the physician. Then do gargling 15 minutes before taking a food. Next is about the prevention. So here complete prescribed antibiotics. So if the patient is having a bacterial infection, the complete dosage has to be completed. Then practice good hygiene, that is washing hands, avoid sharing utensils. Then boost up the immunity by maintaining the healthy diet and taking enough rest. Then the seek medical attention if symptoms are worsened. For example, high fever or increased breathing difficulty or persistent throat pain SMS, they have to seek for the medical attention. Then main thing is avoid close contact with the other person who is infected, avoid sharing food or drinking glass or utensils, and you have to teach to the children to wash their hands after sneezing or coughing. As a conclusion, tonsillitis is a common condition that affects individuals of all ages, and it is mainly caused by viral or bacterial infections. While mild cases often resolve on their own with the symptomatic treatment, bacterial tonsillitis may require antibiotics. Proper hygiene such as regular hand washing and avoiding the close contact with the infected individuals, which will be helping to prevent the spread of infection. And in recurrent or a severe cases, the tonsillectomy may be considered, and the early diagnosis and the appropriate management are essential to prevent the complications and ensure quick recovery of the patient. So here it is affecting to the all age group people and mainly caused by the viral or a bacterial infection. And if it is in a mild case, it will be treated with the symptoms, and in a chronic case like a bacterial tonsillitis means it will be treated with the use of antibiotic. Main thing is hygiene is important to prevent the spread of infection. Thank you.